Dr. Geetha Kamath, a practicing hematologist and oncologist in St. Petersburg, Florida since 1981. She came into Swami's fold at the age of 10 and has received his direct guidance throughout her life and career. Dr. Kamath has been actively involved in medical camps at Prashanthanilayam since 1975, and for the past 2 decades, she has participated in Guru Purnima and birthday camps. In the US, she has organized annual screening and treatment camps since 2004, serving countless underprivileged patients. She is also the chair, Medical Committee, Zone 1 of Sri Sathya Sai Global Council, and will begin this session by presenting the healthcare initiatives undertaken by Sri Sathya Sai Global Council across continents. She will make this presentation virtually. Over to Dr. Geetha Kamath.
Om Sri Sai Ram. My humble pranams to the lotus feet of Bhagavan, who is my mother, my father, and my everything. Respected Managing Trustee Sri Ratnakar, Dr. Mohan, Trustee, Central Trust, Dr. Sundaresh and Dr. Gurumurthy, Directors of Super Specialty Hospitals, esteemed invitees, doctors, nurses and paramedics, loving Sairams to all of you from US. I was fortunate to get divine guidance on ideal healthcare directly from Swami right from my internship days. He taught me 2 important things. One, quality of medical service is more important than the quantity. He said, serve everyone with love and compassion. This is more important than the medicine. Second, unity of healthcare team. This is more important than the outcome of the project itself. Swami was always interested in the process of the project than the outcome of the project. By his grace, overseas team started with birthday camps in early 1970s. It was only a birthday camp. We were an extension of the general hospital. We took care of the crowds during festival times. In 1990s, Swami gave us permission to add the Guru Purnima camp. So it was twice a year. People from all over the world joined these medical camps. People from UK, Nepal, USA, Canada, Malaysia, Singapore, Trinidad, and many more countries. In 2023, all medical camps conducted as a unified initiative, thanks to our managing trustee, Sri Ratnakar, who was instrumental in bringing these 2 camps together. And also, at this point, I want to thank Dr. Ramanohar Rao for helping me, who is my, Ramanohar Rao is my counterpart in India, and we have been working together during both these camps. We saw about 3,000 patients during Guru Purnima camp, over 11 to 12,000 patients during the birthday camps. And as I said, it was an extension of the general hospital. We took care of the crowd, but more importantly, these camps transformed the doctors. Swami was very insistent on continuing these camps for this reason. Going on to US, doing camps in US is very, very difficult. There is a lot of legal issues, medical legal problems in US to do the camps. We did 2 types of camps here. The screening camp is the easier of the 2, where there is no actually doctor-patient relationship. These kind of camps are done all over the country, where they screen the patients for all kinds of diseases, but we are not able to treat during these camps. We started the camp in 2004. It started as a small camps of 100, 200 patients. You can see on the right-hand side, it ended up in the Colosseum, where we saw thousands of patients in the Colosseum. Swami, at this point, instructed me to change the screening camps into treatment camps, which is actually very difficult. But with Swami's help, everything that is impossible becomes possible. With His grace, we were able to start the treatment camps. Swami was very insistent on finding the deficiencies of our community. The screening camps helped us to survey what the deficiencies in the county were. And we found out during these screening camps, patients asked us for dental help. As a result, we started the dental hygiene and treatment camps in the local health department. Even though these were very difficult in the beginning, we were very successful. Second, we were able to do the podiatry camp, which the people in our county requested. Remember, the requirement is different from county to county, city to city, state to state. So you have to find out the deficiencies of our own counties. And these were the ones requested by our county, the dental health. The second one was the podiatry camp, if you can go back. Podiatry camp was a very interesting camp where we were able to wash the feet of the homeless, and the podiatrists took care of them, all the foot care. Following this, we were able to give them all new shoes and socks. This is a very exciting camp. It's very much well received by our community here. Then we started with the eye camps, which is about the most difficult camps, which is very difficult to find help from the optometrists and ophthalmologists. But however, with Swami's grace, we were able to do this. This was also well received by our community, where we were able to give free glasses, not only reading, the prescription glasses, and many people got help through these camps. Most recently, we started the personal hygiene camp, which was well received also by the community, where we brought people who lived in the tents, shelters, ditches. We brought them to the nearby soup kitchen. We were able to provide them with hot showers. We cleaned them from head to toe. We gave them free haircuts. We gave them full set of clothes, and also we provided them with food. This was extremely well received. All these camps were done with so much love and compassion and unity. Swami's presence was felt during every camp, and we were able to practice his teachings. Other supporting projects for the camps, for the overseas physicians, is providing help to super specialty hospitals. Some of the neurosurgeons here have been doing neuro nursing certificate program, neuroradiology coverage. They also help them for neurosurgeries. We also provide surgical equipment when necessary. We also provide seva opportunities for visiting physicians. This definitely needs improvement, in my opinion. If all the doctors from all over the world can join, we can help the two super specialty hospitals. We also did teaching seva by physicians. Moving on to the divine guiding principles for these medical camps, Swami was very particular in working in our own local community. He said, you don't have to fly anywhere in the world to do medical services. Help your own community, he said. He said, you find out the needs of the community. Do not do haphazard services, provide what they need. Only then it is called Sattvic service. He said, customize the camp offerings. If they need dental help, provide dental help. Just like I explained to you, when we saw in the survey by the screening camps all the things they needed, we were able to give dental help, podiatry help, eye health, personal hygiene help. And also he said the doctors have to practice their own specialty. Offer yourself to your own community, he said. Your community is your backbone. You don't have to go anywhere else. And at this point, I'm going to end my talk because of the time limit. Jai Sai Ram, and thank you for all the organizers for giving me this wonderful opportunity. Thank you.